Ever wonder what motivates people to get plastic surgery?
Did they regret it?
What can we learn from the weird and wild stuff that happens at our plastic surgery clinic? We're going to tell some stories, get some laughs, and learn on
Clinic Talk with Sabrina Sajan
on the Plastic Surgeon Podcast.
Hello, my friends. I'm Dr. Javad Sajan, and of course, I'm here with my lovely wife and CEO of Allure Aesthetic, Sabrina Sajan.
Welcome back, and thanks for listening. Please rate and review us on Apple Podcasts to support the channel. On Clinic Talk, we tell real stories of fun, strange, hopeful, and educational things that happen at our clinics from day to day.
We get a lot of weird and hilarious happenings in the clinic.
You can find the clinic at allureaesthetic.com for more information. So, Janu, what clinic stories are we going to talk about today?
So, John, I was talking to the team and they said you had a runaway patient.
Oh my God, yes.
And it was with our new aesthetic physician, Dr. Amstadter, right? What happened?
Yeah. So, we were at our Kirkland location and there was a patient, there was an existing patient. She, comes often for Botox and Dysport. And, she's used to just being in and out, usually takes 10, 15 minutes, to do her treatment usually. So that's what she was expecting. But this time she was coming for filler. So she wanted lip filler and she wanted Botox. So we said, great, so she got scheduled. She came in and then unfortunately the patient before her was late. So two patients arrived at the same time. She was early. The patient before her was late. The patient before her had her pet dog with her.
Service dog?
No, it was not a service dog. We asked her. Yeah, it was a pet.
Do you have a pets allowed sign at the office?
No, she thought she could bring her pet for her injectable treatment.
At a medical facility?
Yes. That's
a typical Eastside patient.
So she brings a little furry little pet with her. We're like, hi, ma'am, we're sorry you're unable to have your pet in the office with us because we have a few employees actually that are allergic to dogs. So we just don't want anyone to have a reaction or something bad to start. So we told her, unfortunately, we can't have the dog in here. So now there's a whole situation happening where the filler patient is in the lobby waiting because she's like, when are they going to take me back? I'm early. And then now she's late because she's running behind, couldn't find the building. And then now she has a dog.
Oh, man.
So we're like, okay, what should we do? So she's like, okay, I'll be right back. So then we're like, okay, what is she going to do with the dog? Because it's really hot. It was just like, I think 80 degrees or 90 degrees that day outside.
Yeah, you can't leave it in the car.
No.
We love dogs.
And she goes out for like 5 to 6 minutes and then she comes back, right? And we're like, oh, okay, we don't know what she did with the dog. We'll see what happens.
So where was the dog?
And then we look outside and it's tied on the pole outside, just hanging out.
Oh my God. What if it got away?
I don't know. What if a car went on and dog ran away?
To those yellow poles in the parking lot?
Yeah.
Oh my God.
She tied the dog's leash to the yellow pole in the parking lot and just came back for her injectable.
That's wild.
So, our doctor, then she was like, oh, I should just take her back first because the dog is like waiting outside by himself. And she didn't want the dog to like run away or anything or get ran over. So even though she was late, we're like, okay, well, let's get you in. So doctor took her in to one room. And then in the other room, she took the filler patient. I was like, hey, the patient before he was running behind, like there's a situation because she has a pet with her, but the pet's hanging out outside. So we're just going to try to get her in before you. And she's like, okay, fine. So then she gets her room. She wants lip filler. So she's numbing in the room now. So she has like topical numbing on her lips. And in one room, and she's sitting in there. In the second room, Dr. Amstadter is going to do the Botox for the dog lady. And Dr. Amstadter checks on the lip filler patient like, hey, it's going to be a few more minutes. Because then Dr. Amstadter usually does Botox for her. Then she wanted to know what Dysport was, dog lady. So then Dr. Amstadter explains to her, like, this is the difference between Dysport, this is the difference between Botox.
So Dysport and Botox are both what are called neuromodulators, or they're prescriptions that are injected into the skin, and they're based on botulinum toxin. and they temporarily relax the muscle. Now, there are different brands, but really same function. So the patient was thinking of switching.
Yeah. So she's always been a Botox user. She wanted to know what the difference was of Dysport because she thought that she could get more Dysport for the same price because of the conversion.
So the way it works is, on average, 1 unit of Botox equals 3 units of Dysport. So that's the conversion, we believe in. Most people believe in that. So Dysport, you get more molecules, but the cost is relatively the same because it takes 3 to 1.
And you get the same amount of product?
Same amount. You get same volume of product based on reconstitution, but you do get more little molecules.
Okay. So yeah, she was a little confused because she's like, oh, so do I get more Dysport for the same price? And then Dr. Amster had to explain to her the difference and what the pricing is and all of that. So then this conversation started happening with the dog lady, and then the filler lady's waiting. Oh, let's see what time it is. It's been 30 minutes now. So she's still waiting.
Because Dr. Amstad was talking to dog lady.
Yes, about
the dog lady is not worried about her dog.
No. Then Dr. Amstad was like, okay, if you really want, why don't you try Dysport this time? Maybe, you'll like it. She explained the benefits, the differences, and all of that.
Did she go out to check on her dog during any of this? I
don't believe so. We were watching it from the window just to make sure the dog was okay. But then, so they get in this conversation about Dysport and Botox, and she's almost about to get Dysport. Then she feels she asked Dr. Implant, am I going to break out if I get this? What kind of product it is? Is it makeup? If you switch the brands, you start, your skin might not do so well. And so all these questions start happening. And then the filler patient's getting anxious and worried. She opens the door for a second, looks outside, trying to find Dr. Amstatter, doesn't find her. So the
filler patient left the exam room.
No, first she just opens the door. So we hear the door open. And then when she opens the door.
She pokes her head out.
Yeah, she pokes her head out. And we're like, hey, Dr. Amstatter's still here. Don't worry. She's like, I just wanted to check. I don't know why you shouldn't leave yet. She's still here. She's finishing with other patients. She'll be with you shortly. She's like, okay. And then she goes back and you can see she's getting red and nervous. We're like, oh my God, Dr. Amstatter, come on, let's go. And the dog lady's asking more questions. And then she's like, oh, if I get Dysport, will I die? The doctor was like, I don't think you'll die.
Yeah.
But she was like, well, if you don't feel comfortable, let's just do Botox this time. There's no reason to switch. If you're happy with Botox, let's just do Botox.
Yeah, literally, guys, it's the same thing, same product. I think Dysport works a little quicker, lasts a little longer. Some of the studies show that, this nice dog patient is just freaking out for no reason.
Yeah. So she thinks she's going to die if she gets Dysport. I'm like, okay, no, scratch all that. Let's just do Botox.
It sounds like a DNS patient.
She had a lot of questions. So then they're like, okay, now she's want Dysport, right? Okay, so Dr. Amstatter goes, grabs a Dysport for her, starts, getting the vial, whatever. And then she goes back to her room. And then meanwhile, we see the filler patient hanging out in the hallway, running around, looking for Dr. Amstatter with her mask on her lower lip with her topical numbing all over her face, smeared with the vibrata in her right hand, running around looking for Dr. Amstatter.
That's too much.
And we're like, oh my God.
So the patient, she had numbing cream on for lip filler.
Yeah.
So she has a white mustache of numbing cream.
Yeah.
On the upper and lower lip. And then she's running around with the mask on her chin.
Yeah.
And the vibration device to decrease pain.
Yes, in her hand. And she's running around right, left. She's looking right. She's looking left. She's looking for Dr. Amstatter. Is she here? Is she here? She's like, and then we hear her because I was near the front desk area. And I hear, where's the doctor? Where's the doctor? And I'm like, oh my God, the patient's freaking out, guys.
Yeah.
So then I run to the back lobby and I'm like, hey, are you okay? And then she's like, no, where's the doctor? Where's the doctor? And she's super anxious and super worried. She was getting very hyper, she didn't know what to say. Then I was like, okay, let's come to the front desk. We'll help you. Then she came to the front desk and she was explaining how she thought it was only going to be a 15-minute appointment because she's been here before. And I was like, yeah, but last time you came, you only got Botox, which is a much faster treatment. Lip filler treatments do take longer because we numb you, want to make sure of all of that. And it's an hour-long appointment compared to a Dysport Botox, which is a 20-minute appointment. So they're explaining that to her. She's getting super anxious and worried. And then she thinks Dr. Amsatter is not nice anymore because she left her in the room, even though she checked on her like over and over again. So then eventually we're like, okay, maybe like, you know, I don't know if you're too nervous today. I don't know if it's a good day for you to get this filler. And then I was like, we're happy to like, you know, not charge you anything. Like maybe, you know, you just need to go home for the day. But then she was like fairly upset because she already waited for 30 minutes. She was like, I just want to get my treatment. I'm already here. Just want to do this. Can you just do it right now? And I was like, have a seat in the lobby. Then I'm going to go check and see if a doctor can do it for you.
Oh yeah. That's when you came and got me.
Yeah. That's when I came and got you.
Yes.
So then I went back outside to her and I was like, hey, Dr. Sajan's available. I was like, I apologize. You know, it was a error in the schedule with the patient before you came late. So we're trying to get her in, but it ended up being a longer appointment than we planned. So I explained everything to her. And then even though like she had yelled at us right before that and screamed at us, she apologized and she was like, I'm really sorry. I didn't mean to yell at you. You know, I was just getting very anxious and nervous and the time kept passing by. So then the patient was passed to you.
Yeah. And I saw her. She was nice. I can understand why she was upset for waiting, but just, you know, very anxious. People can get anxious. I did the Botox treatment and I did the lip filler. Very, very smooth. I would say definitely more anxious, top, you know, 10% of anxiousness. Injection went great. Patient's very happy. The result was a wild success.
Yeah, she was definitely very happy. She came to the front desk and she's like, oh, I love it. Thank you so much. Thank you so much. We're like, no, sorry about the, you know, the weight and everything, but she was fine. And
I would wish to take all the patients and treat them that, you know, some people, you know, if they don't schedule a few months ahead of time, it's a little bit hard to get on the schedule. So that becomes the challenge. And so that's why we have other great providers. Everybody who injects for us, I've trained from ground up. So they all do a great job, but certainly some people want to come to me and I love them all. I want them all. But there's only, you know, only so many hours that I can push. Like today is Saturday, we did a whole day of injections. You know, we're so blessed. We have such a high demand of people who want to see me. So what we did was we opened up some special Saturdays and I'm doing select patients who can come in and we take care of them for 7 hours.
Yeah.
Right. So it's fun. It's exciting. I love doing it. We have great providers people can see and they can come see me.
Yep.
So John, I had a very upsetting thing another doctor did.
Oh, again?
Yes. So a lot of people know I fix botched work. And whenever I get bad work or other people's surgeries that I'm fixing, it's not necessarily bad. Patients change their mind. They have a change of heart. They want something different. I never talk bad about the provider whose work I'm changing. And sometimes it's not even fixing. It's changing, right? Things sag with time. People change their minds about implants. So I had a really amazing patient. I saw her for a consult. So she had a breast augmentation done with a mini lift type thing from another doctor based in Bellevue. And she had the surgery done about 5-6 years ago. And she thought they looked okay. And she wasn't that happy with them. She was dealt with them. But she felt the implants were making her sick. Now, it's not common. Is she felt she had breast implant illness. She didn't know, since she had the surgery, she felt tired. She felt fatigue. She felt her body was attacking itself. She had GI issues, sinus issues, all non-specific things. Now, breast implant illness is controversial. Some people believe in it. Some people don't. Now, I probably do more implants than most people in this part of the country. But I also do believe in a very rare population, the implants don't sit well. Like anything, right? 1 million people take the vaccine. I love the vaccine. Some of the people get a bad reaction. Doesn't mean you stop the vaccine.
Of course.
You try to figure out who reacts and treat them appropriately. So this lady felt the implants made her sick. So she went back to her original doctor and he dismissed her. He told her, he basically told her she was not sane, very not nice. So then she does more research and she comes to me. And I have a consult with her. I told her, look, you have, you're telling me you have breast implant illness. I want to let you know it's controversial. There's no test I can do for it. You have a constellation of symptoms that may get better if we take out the implant with the whole capsule and everything with it, called an en bloc surgery. And she thought about it. And I said, can we get your record so I can review what the other doctor did? Because when I did my exam, she didn't have a straightforward operation. She had an implant and she had a mini lift and she had some scarring was very thick. The areola was way too enlarged. I felt the lift was inadequate. I didn't tell the patient this. I didn't say one bad thing. I said, I understand you had surgery done. I'm happy to help you. But when I assessed the surgery, I would say it's not a good surgery, but I didn't say that. So nevertheless, the patient fills out a records release, and we submit it to the doctor's office to get the records. So then we never got the records. So then the patient calls us saying, hey, what's going on? How come you guys you were going to call me after you got the records? We said, yeah, we never got them. No, nothing was sent to us. We thought maybe you changed your mind or something. So then she calls that office and she gets the records sent to us, and she's having second thoughts about the surgery. So she comes back to see me. Before, she was eager to book, right? But I said, I don't want you to book till I review your records. So then I reviewed the records, talked to her, but then she was like, oh, I'm having second thoughts. I'm like, okay, come in, let's talk about it. So she comes back and I'm like, what's going on? She's like, I want to tell you something. I'm like, what do you want to tell me? She said, the doctor who did my surgery from Bellevue, he emailed me and said, me, Sajan, is basically not a good person, and I shouldn't have you do my surgery. And that basically this doctor told my patient that he felt basically breast implant illness was a hoax. It's not real. He's done many in-bloc type surgeries and has a 0% success rate. And I, with God's grace, have 100% success rate on my in-blocs, knock on this fake wood. No one's ever felt their symptoms didn't get better. So his doctor emails her saying, oh, basically he's no good, he's a phony, doesn't work, blah, 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 blah. So I talked to the patient. I said, look, this is a controversial disease. I agree that there's no guarantee that this is going to work, but this is the options. If you want to do it, great. If not, all good. And she's like, well, I thought about it and I want to sign up. And I'm like, oh, wow. And I was like, why? She's like, one, I don't want the implants anymore. They don't fit my life. And number two, I think I'm getting sick because of them. And number three, then I asked her, well, why didn't you go back to your original doctor after he emailed you? She said, well, this doctor sent me an email saying everything I just said. And I felt he was yelling at me. The original doctor was scolding me. I felt he was scolding me over email because I didn't like the implants anymore. And he felt personally attached to the implants. And the doctor emailed her and called her to talk bad about me. And she thought that was so unprofessional. And she's like, if he's talking bad about you, there must be something good about you. So that's how I'm going to book. Really nice lady. She's very kind, very sweet. A normal person like you and all of us, I'm not going to give her name or anything, but she works in the service industry. She's like a housekeeper. Very sweet person. And I thought it was just so unprofessional, unethical, and horrible of a provider yelling at a patient just because they changed their mind. I've done surgeries, although I don't know anybody personally, or there might have been one actually, sometimes I've done surgeries and the patients, rarely, very rare, maybe decided to change their mind, didn't like it, and they went to somebody else because they wanted it changed. I never yelled at that patient or the doctor. I released whatever records they wanted. If they had questions, I'm happy to answer them because sometimes it happens. Not every relationship is perfect, right? A doctor-patient relationship exists, so everybody's happy. Sometimes patients change their mind. Sometimes they want to do something different. Sometimes they're embarrassed to go back to the original provider, so they'll go somewhere else. For me, it's not personal. I feel it's our job to serve the patient. If I'm the best one to do the right thing, I'm happy to help. If there's somebody else, do it. But talking badly just made that original Bellevue doctor look unprofessional. Patient came to me anyway, and it doesn't help the field. It hurts everybody. It makes everybody look low and stupid. At the end of the day, we're here to serve, and you got to remember that. Surgeries will come and go, but you have to live with the service you do for people, and that's what taking care of patients means to me.
For sure.
So, talking about that, I had a really interesting. One second. How many minutes have we, Alex? 19. Okay. So on that note, I had a really interesting case I got from Mexico. So I had this amazing patient who came to me during COVID. Remember, she called the office and she wanted to book. So she basically had an implant done and a lift in Mexico. And then she called panicking, saying that my implant popped out during my mammogram. And I went to the hospital. They took it out. I have drains. I need someone to fix my chest. I don't have anything on my right side. So then she said it was an emergency. So it was during the pandemic. So because she needed urgent help, we saw only emergency cases. I saw her. And she came in. I'm like, what's going on? Very nice lady. And she said, well, so I had to lift an implant down in Mexico. I came to the US and then my right implant kept draining. And the doctor from Mexico kept sending me antibiotics and it kept draining and it stopped, it drained and it stopped and it drained at the incision point of the lift. It was draining specifically at the trifurcation where the T comes together when you do a breast lift because it's an anchor incision around the nipple down on the side. So she has this chronic drainage, it goes up and down, and the doctor was like, oh, it'll be fine, keep taking these antibiotics. And he has her on antibiotics for 5 months. 5 months. So then she goes for a routine mammogram and she has this intermittent drainage. And when they do the mammogram, they squeeze the breast really hard and the implant, half of it pops out.
Oh my God, out of the incisions.
Where she was having the drainage.
Oh my God.
So then they immediately send her to the emergency room at Virginia Mason. The doctor takes out the right implant and puts a tube in. And then she said that doctor there didn't have a lot of expertise in implants and he recommended she follow up with someone to fix. That's why she ended up in my office. So what happened is because she had a chronic infection, the skin and muscle broke down. And when she had pressure from the mammogram, it popped out. So then I saw her and I told her it was going to be a complicated course because what happened is because of the chronic infection and having everything removed and collapsed, the pocket and skin had shrunk. And when the doctor put her back together at Virginia Mason, he removed some of the skin that was very thin. So now there wasn't enough skin. So I shared with her, I can help you do the surgery, but it's a long process. Basically, to help fix her, what we had to do was we went in for surgery. We had to put in a temporary balloon in her right chest. So it was a multi-stage operation. First, we had to put a balloon. After we expanded her, then the plan was to put an implant in and see what happens. So what did I do? So the first stage was called a tissue expander. We took her to surgery. We went in there. We put the balloon, and we sealed it up. Sent her home. She lives 3 hours away, and then she came back every week. And I filled the balloon in clinic with her awake.
Saline, right?
Yeah, with saline. So the way the balloon works is it sits in the chest and it has a special magnet inside. That's inside the chest. You have a magnet finder that when she came to clinic every week, you take the magnet finder, you take it across the chest, and then there's a little pointer that points to where the port is where you fill. So I took the magnet finder, I found the filling port, and we slowly expanded. Because we had to grow new skin. She didn't have enough skin to put a new implant in.
It took many weeks, right?
Yes. We did 6 weeks of expansion. And after the 6 weeks of every week, we put in a few hundred cc's. And after the 6 weeks of expansion, when the balloon was big, we let it sit for a few more weeks. And then we went in. After that,
do you do that so the body can get used to it too?
Yes.
The size and everything?
Exactly. So you do it because she didn't have enough skin. So by expanding, what happens is you grow more skin because it stretches. And you make the pocket bigger so you have room for an implant because she had 1100 cc implant.
Oh, wow.
Yeah, they don't make those in America. So after we expanded, and the poor lady drove 4 hours each way, once we got it to the size and we took her back for surgery, and the plan was to put in 800 cc's, remove the 1100s, and we were going to go with the silicone gel implant. So we did that on the side that wasn't leaky, it looked perfect, and then the side that had the issue, I went in, took the balloon out, and took out the capsule or the scar that she had, and I put a brand new implant in. And then when we put it in, she healed well. But one implant fell too low, the new implant, because she had no support from the old resection. So now the final stage, we're going to take her back in about 3 months. We're going to have to use some mesh, and we have to reconstruct the bottom half of the inside of the muscle. So there's something to hold the implant so we can make it more symmetric.
What is a mesh?
So a mesh, what I use is a dissolvable matrix. It looks like a
net.
Yeah,
almost,
like a
right?
net. Yeah, like a thin net, and you suture it to make a pocket where the implant can sit. So she's going to need that now to finalize and get her symmetric. She has 2 breasts. They're safe. Just one is a little bit too low.
Because she has no skin there too. Exactly.
So, the moral of the story is there's nothing wrong with having surgery outside. The biggest challenge is follow-up. 50% of surgery is healing, I believe.
I remember I can't remember if she told one of our staff members or one of the clinic staff team. She was like, I really wish I wouldn't have gone to Mexico.
Yeah.
I think she feels a little embarrassed too to talk about it. She's like, I'm embarrassed to say that I went to Mexico to do this and now look where I have to do to fix it.
She probably spent 5 times the money.
Yep.
Because she paid for Mexico and then the reconstructions have all been out of pocket. We've helped her. And actually the last surgery I'm doing for free because I feel bad about the whole situation for her. So, but it's been a long journey to make her better. We're almost there.
Yeah.
Almost there. She didn't want to be a part of the podcast series because she was embarrassed. That would have been a unique story. Very sweet, kind person.
Very nice.
Normal person like us. One of the nicest people I've had the privilege of taking care of. So when you don't have good follow-up, even for local surgeries, it becomes a disaster. And if she would have gone back to Mexico earlier, the cure would have been the implant needed to come out. She needed to heal and put it back. And if you would have taken it out early, you wouldn't have needed to remove the skin and do all that extra work. And that's why poor lady ended up where she did.
Yep.
Thank you for listening to Clinic Talk on the Plastic Surgeon Podcast. Please rate and review us on Apple Podcasts to support the channel.
Tune in next time for more Clinic Talk. We have more great stories coming your way.
For my live surgeries on Snapchat and adventures throughout the week, catch us on all social media at Real Dr. Seattle.
See you next time. Bye.
Bam. What?